Okay, the scene is safe. Or, I guess I should probably ask you this now. Okay, is the scene safe?
The scene is safe.
Okay, I have my BSI on. Do I see any bystanders to provide sample history?
There are no bystanders.
Okay, are there any other patients?
No other patients.
Okay, so at this point, initial assessment looks like a trauma victim from the car crash. I believe looks like he's in his 40s. At this point, I'm going to direct a partner of mine to begin manual stabilization of the spine. I'm going to make patient contact. Oh, as of this moment, I don't see any need for any additional resources. So I'm going to begin patient contact after stabilization of the spine. Sorry, can you hear me? Can you hear me? I'm Connor Bowen.
No response.
EMT. Okay, sweet. Pain response? Any
No
response?
response.
Okay, so at this point, I'm going to check the airway. Do I see any obstructions?
No visible obstructions.
Okay. Am I hearing any snoring, wheezing, coughing, gurgling?
Yes, you hear snoring.
Snoring. Okay, so the airway is not patent. So I'm going to go ahead and have my partner insert an oral pharyngeal airway. Does the patient accept?
Patient does accept.
Perfect. Okay, so at this point, am I hearing breathing, breath sounds?
Yes.
What quality and how fast?
36 breaths per minute, shallow and rapid.
Okay, so I'm going to have my partner begin bag valve masking at one breath every 3 to 5 seconds with supplemental oxygen, supplemental high flow oxygen at 15 liters per minute. Okay. Does the patient have? Let's see here. Does the patient have a pulse?
Patient does have a pulse.
Okay. What quality of pulse?
Pulse is weak and rapid at 140.
Weak and rapid at 140. Okay. I'm going to note that. Now I'm going to begin a blood sweep. Do I see any blood?
No.
Any underneath the right arm?
No.
Underneath the left arm?
No.
Underneath the right leg?
No.
Underneath the left leg?
No.
Okay. Underneath the torso?
No.
Okay. Perfect. Okay. At this point, I'm going to make the decision to continue with the rest of the assessment in the ambulance. This is a high priority patient because he is unconscious. And at this point, I'm going to expose the patient. Upon exposure, do I notice anything?
You see crepitus on the left chest.
Okay.
Possible deformity of the left femur.
All right. So at this point, I'm going to begin my secondary assessment. Am I seeing any deformities, decap BTLS in the upper face, upper jaw, nose,
No.
eyebrows?
No.
Okay. Am I seeing any battle signs or fluid in the ears?
No.
Okay. At this point, I'm going to begin looking for jugular vein distension and tracheal deviation. Do I see any?
No.
Okay. I'm going to feel for any step-offs. Do I feel any?
No.
Okay. What skin moisture, color, and temperature am I observing?
Pale blue and moist.
Okay. At this point, I'm going to check the rib cage or chest plate. I'm going to check the shoulders at a time. Together, the collarbone. Am I noticing anything or about something? Okay. I'm gonna have my partner apply a C-spine and stabilize that. So, continuing to assess. Okay, and I noticed deformity in the left side, I believe.
Mm-hmm.
Okay. So I'm gonna check the ribs, avoiding that area. Am I noticing anything else in that area? Except for the crepitus and the chest injury?
Nope. Left lateral chest bruising, deforming the left lateral chest and crepitus.
Okay. And so I'm gonna check the abdomens. Abdomen. Am I noticing anything? Any abnormalities?
No.
Okay. Test the pelvic girdle. Am I noticing anything?
No.
All right. Checking the patient's right leg for decap BTLS. Feeling anything?
Clear.
Seeing anything? Okay. Sweet. Do they have capillary refill?
They do. It's weak.
Weak. Okay. Sir, what toe am I holding?
No response.
Can you push against my hand?
No
Can you
response.
pull against my hand?
No response.
Okay. I'm gonna check the patient's right leg. Am I noticing anything?
You have. Oh shoot! I call it. No, that's left leg. That's
Yes,
left,
that's the left leg.
upper femur swelling.
Okay. I'm gonna note the difference in size between the different thighs. Do I have capillary refill?
You do not.
Okay. What toe am I holding, sir?
No response.
Can you push against my
No
hand?
response.
Okay. Can you pull? Okay.
No response.
All right. Move to the patient's right arm. Am I noticing any decap BTLS?
No.
Sir, can you squeeze my hand?
No response.
Do I have cap refill?
Weak.
Okay. What finger am I holding?
No response.
Okay. Alright, I'm gonna check the patient's decap BTLS. The left side. Am I noticing anything?
No.
Sir, can you squeeze my hand?
No response.
Do I have cap refill?
Slow.
Okay. What finger am I holding?
No response.
Okay. So at this point, I'm gonna check the posterior of the patient. I'm gonna coordinate my team to log roll him. What's in here? Am I noticing any decap BTLS in the posterior of the patient?
No.
Okay. Rolling back. At this point, I'm going to gather vitals on his uninjured arm. I'm gonna put my stethoscope in, blood pressure cuff. What blood pressure do I get?
80/46.
80/46. Okay. All right. I've already determined the patient's pulse and the respiration rate when I first arrived. Okay. I'm gonna auscultate for chest sounds. I'm noticing anything? Perhaps one side of the chest is rising while the other is not. Maybe.
So sounds nothing remarkable.
Okay. Is the chest rising at equally?
No.
Okay. To know. Okay. I'm gonna check for pearl. Are the pupils responding to light? Are they even?
Yes.
Okay. All right. As the tracheal distension or jugular vein distension, tracheal deviation or jugular vein distension changed anyway?
No.
Okay. At this point, I'm going to reassess the patient every 5 minutes because they are a unconscious patient.